What we know about the real world status is that that many different groups, research groups, are in fact conducting this kind of studies. And the first question is, why do we need this status? And the reason is that why we need this status is that because data derived from the clinical trials, it's something different. From the clinical trials, we know that about efficacy, tolerability, and safety in the group of patients without, let's say, major comorbidities that might influence your response, to the drug. And that's why real-world evidence studies conducted after registration of this medication are very, very important, because they include the patients that we usually see in the clinical practice with the various comorbidities, with the complex, let's say, clinical presentations, high frequency, persistent pain, also taking some other medications. So all these aspects are important, and that's why when we have data coming, data what we call real-world data in this context is important, because it is kind of increase our confidence about the medications in terms of efficacy, safety, and tolerability, and special group of patients, showing that even in these difficult to treat patients, that medications that we are using now are efficacious, okay? And in the vast majority of patients, we see that they tried different medications before. In one of our recent study from our group, we showed that even the patients taking 50% of the patients tried 7 different medications previously, they still responded to this new class of medication. In the real life, what is important now is that to remember that these medications can be efficacious even in the patients with, which we call difficult to treat. We tried different medications. We used to say, well, if the patients tried 4 or 5 medications, the likelihood that the new medication is going to work is almost 0, right? But now, from the evidence that we are accumulating right now, we know that it's not true. Even in these difficult to treat group of patients, you can achieve nice results, such as, let's say, that about 50 or 60% of the patients, they might report at least 50% reduction in monthly migraine days, which is, let's say, a huge difference for somebody who has almost everyday headache and a very frequent migraine.